Now moving on to chromosomal disorders, cytogenetic disorders. There are structural disorder like deletion, insertion, inversions. They are not much important here, and numerical ones are important. We will discuss only the autosomal ones. Most common numerical disorders are there, and then amongst numerical trisomies are mostly there, and amongst trisomies mostly it is the Down syndrome or 21 trisomy. So the question asks about Down syndrome. And then among sex chromosomes, mostly it is the Klinefelter or XXY pattern. It is discussed on page 638 in details. We'll discuss in another section separately with disorders of sexual development because sex chromosomal disorder are associated with them. And we'll discuss only the autosomal trisomies here, the three famous trisomies. So the first one is Down syndrome or trisomy 21, second Edwards syndrome, third is Patau syndrome or 13. Down syndrome should be read in details because each and every line is an MCQ and some other are added on here. First of all, it is trisomy 21, so 21 chromosome is involved. That is most important. And then mostly the patient presents with intellectual disability that is called low IQ, sometimes written as low IQ, and or mentally retarded as well. Then flat faces, prominent apicanthal folds, they are between eyes, and then a single palmar crease. Both the creases are joined together in a single form that is called simian crease. And incurved fifth finger, we know it is incurved here. Gap between first and second toes, it is seen in foot mostly, and then and in hands as well. So then duodenal atresia, GIT symptoms, this is asked. Hirschsprung disease, this is asked. Again GIT disorder and disorders associated with the cardiovascular system, congenital heart disorder, for example ASD. And in eyes there is brush field spots seen. And then Down syndrome is associated with early onset Alzheimer in age 40s. That is MCQ asked often because 21 chromosome codes for amyloid precursor protein that will lead to amyloidosis, and amyloidosis is associated with Alzheimer. And then increased risk of acute leukemias, mostly it is ALL because it is acute lymphoblastic leukemia, or they are AML as well. So it is increased risk of acute leukemias. For 95% of the cases, it is the meiotic non-distinction. Here down, there are two processes, meiosis 1 and meiosis 2. Meiosis 2 is just like mitosis. Meiosis 1, in meiosis 1, chromosome numbers are halved. So if one side has all the chromosomes, for example, 21st pair chromosome, both the chromosomes, the other cell won't have, and in the end, one chromosome will be extra in these two ones. So these sex chromosomes fertilizing, if in the egg, mostly in case of female they are in the eggs, not in sperms. So these sex chromosomal meiotic non dysfunction are 95% of the cases. And we can write it separately here that if less than 20 years, they 1 into 1500 live birth chances, usually it is 1 into 700 that is asked, and if more than 40 it is 1 into 100 live births, and then if more than 45 age, 1 into 25. These last two are also asked. They are not given here, so add them up. And then other they are not given here. This less than 20 years is not given here. And 4% are due to unbalanced Robertsonian translocation. Mostly it involves chromosome 14 and 21. And about Robertsonian translocation, it is important that 15% of the cases it will be transmitted to next generation if present in one generation. uh, then only 1% cases are due to post fertilization mitotic errors, for example mosaicism. If these cells form the eggs and they fertilize each other, and they are the normal cells without non-distinction process, and after fertilization zygote, in zygotic divisions, post fertilization mitotic divisions in growth, just 1% of mosaicism is there. uh, it is said that the famous personality Nusrat Fateh Ali Khan had this mosaicism, and he was a Down syndrome patient. Don't know about authenticity. So, uh, important towards diagnosis. Coming towards diagnosis, first trimester ultrasound will show new increase in nuchal translucency. It may be asked or hypoplastic nasal bone. Important are these markers. There two things will increase: beta HCG and inhibin A. Beta HCG and inhibin A increases, and decreases are the alpha fetoprotein AFP, estriols, and placental associated plasma protein A. So these three will decrease, and these two will increase: beta HCG and inhibin A. And we can see here the first trimester screening, we have beta HCG and PAPPA, placenta associated plasma protein A. Beta HCG increases, placental associated protein decreases. And then second trimester we have add on estriol, that is called triple screening. So beta HCG, inhibin, and estriol. In fact, it is alpha fetoprotein, beta HCG, and estriol, I think, is added. So triple estriol, not diol or any other example. It is estriol included in triple screen. Uh, we also know that high AFP is seen, alpha fetoprotein is seen in neural tube defects, but specific marker for neural tube defects is acetylcholine esterase. That is another MCQ, page 491. You can add on it. Also, marker of alpha fetoprotein is marker of hepatocellular carcinoma and testicular carcinoma, for example, York sac carcinoma. They are given on page 653. So Down syndrome is very important. All details are added on, and you can read it again and again. Edward syndrome 18, Edward pronounced same, micrognathia or small jaw, that is asked. Otherwise, we have this fist, uh, uh, prominent occiput, rocker bottom feet, intellectual disability, non distinction, as happens in Down syndrome also, clenched fists, and low set ears. So, low set ears and micrognathia are asked mostly. And Patau syndrome, we have microphthalmia, eyes are smaller, not the jaw, and microcephaly, head is small. In reversely, there are prominent occiput here in Edwards. So these two often confuse a lot. You need to know the Patau, it is mostly peas, cleft palate, cleft lip, hollow prosencephaly. Polydactyly is asked, one extra finger. It will be Patau syndrome. Cutis aplasia, polycystic kidney disease, and microphthalmia and microcephaly. Smaller eyes and smaller heads are associated with Down syndrome and other P's. Another thing, that horseshoe kidney is not associated with Down syndrome. All the associations are written here. You should also write down not associated with horseshoe kidney, because it is sometimes asked. These are the important points from this page, that is about autosomal trisomies. We will discuss sex chromosome related trisomies, Klinefelter and Turner, in details in another chapter with sex chromosomal disorders. Other genetic disorders should be discussed with this autosomal trisomies, so they do not confuse with each other, and these are most important. Down syndrome is often asked in exam. Hope this will help in long run. Thank you.